If your child is having persistent pain in the abdomen around here, the right side, and it's not going away, this could well be appendicitis. Appendicitis is an emergency condition, and this is what you need to know. Appendicitis is inflammation of the appendix. Appendix is a little structure that's worm-like, and it's coming off the large intestine about the right side here. Basically, it gets blocked by feces, and what happens then is that inflammation occurs in the appendix. Once the inflammation starts, it progresses and gets worse, and to a point where it's swollen, filled with pus, and then it bursts, spilling the pus into the tummy. When there's generalized pus in the tummy, the child gets very sick, and they will need more resuscitation. They need a longer course of antibiotics, and therefore the stay in the hospital is longer as well. In addition to that, the operation can be more complicated because not only do you have to deal with the appendix, which is burst, you have to go around the rest of the tummy to clean up all the pus that's been spilled in the tummy cavity. And therefore, the whole process of recovery is so much longer. So before it bursts, it's best to get it treated so that the recovery is fast. The symptoms of appendicitis are usually a little bit of nausea, a bit of fever, which is not very high, pain very specific to the right lower abdomen down here, and it doesn't go away. And sometimes if the child starts to walk, the pain is worse, or when they move their right leg especially, it makes it worse. One of the telltale signs is when they are in the car and the car goes over bumps, they get pain there. That's a sign the inflammation has already got to the covering of the tummy. So parents should treat this kind of symptoms as an emergency. Take your child to the emergency department to be assessed by a pediatric surgeon. And once assessed, we need to see what the core problem is. I often do some blood tests, an ultrasound scan, which is all that's required. I rarely do CT scans in children. The whole process should take about 2 hours. And once we've done the examination, there should be enough information to decide whether the child has appendicitis.